Medical officials are expecting COVID cases to spike this winter, and a healthcare system already under tremendous strain will need to find ways to handle it. 116 people are hospitalized with COVID in Onondaga County right now. Local ambulance crews say the state needs a new plan because they've been stretched to the limit for months now. CBS 5's Connor White is with the Live Eye in Camillus with our continuing coverage now.
Waves Ambulance in Camillus have had to turn on the emergency lights on their trucks far more often this year compared to last year. In 2021, they've responded to 140% more calls than they did in 2020, and that's with a month and a half left in the year. The director here says this situation isn't sustainable. At around 12:30 this afternoon, Eric Kehoe returned from his 6th emergency call of the day.
A lot of us are stubborn in this business. We think that we can outwork the problem. The problem is that it's gotten too big. It's more than we can manage.
He says patients that avoided health care at the height of the pandemic are now overwhelming ambulance crews and hospitals that are short-staffed. Still handling COVID-19, with 116 hospitalized with the virus countywide Wednesday.
The volume that we're seeing has only increased. The hospital's ability to handle that influx of patients has decreased.
About a month ago, Upstate's ER director sounded the alarm, calling it the worst crisis he's seen in his career. According to Kehoe, the state has been aware of the strain since midsummer, concerned a mass casualty event at the fair would overwhelm Syracuse healthcare.
That's when the state health department stepped in and started trying to help fix the situation. But at some point we stopped finding a solution. We just are kind of having meetings over and over again, talking about the same things without really finding solutions.
Governor Kathy Hochul in Buffalo on Tuesday, concerned about surging cases in Western New York, addressing a question on how the state is assisting hospitals.
I have everything from 1,000 student nurses who are ready to be deployed like this. If it gets dire, we have the National Guard, we have EMTs who are willing to assist. So we have resources, but the first question we ask is, have you done everything you possibly can to avoid this? I mean, it's a collaborative approach that we're taking as well.
Kehoe says things have been dire for months now.
No, nothing has changed. I've been in EMS or pre-hospital emergency medicine for 32 years, and I've never seen volume to this level.
The director here says you can help the situation by not making ambulances or the hospital your first go-to place for medical care. He says to seek care instead at an urgent care or a primary care doctor, so long as it isn't an emergency situation. If you're confident it's an emergency, he says not to hesitate and still dial 911, and they'll be able to get you the help they need.
Has raised concerns about increasing COVID cases. Leaders in Monroe and Erie counties are calling it a 4th spike.
Many counties here in central New York are seeing cases increase, but not at the same level as out to the west of us. Others, though, like Oswego County, are seeing that severe spike. Tony Black reports.
COVID-19 cases are increasing in many parts of New York State. Governor Kathy Hochul especially noting areas west of central New York. But some counties here are actually seeing a higher percentage of new cases than the west.
Oswego County immunization rates among these 5 is relatively low.
Jian Cheng Huang is the public health director for Oswego County. The county has nearly a 9% 7-day average positivity rate, the highest in our region. Erie and Monroe counties are at 8.2%. He says the high rates west of us are alarming, but isn't sure if it will impact our whole region.
It's harder to predict, and I don't want to be a predictor because most of predictor failed.
Take a look at the state's COVID-19 tracker for 7-day average positivity rate. You can see counties like Onondaga, Cayuga, Cortland, and Tompkins are a lighter shade of orange, but more to the north and east, counties like Oswego, Oneida, and Madison are a darker shade of orange, meaning their percentages are higher.
Vaccinated people, their immunity reduce waning.
The public health director says vaccine immunity wearing away, the risk of transmission in the county, and lower vaccination rates are the reason. Oswego County ranks in the middle of CNY counties for vaccination percentages. Madison County has a higher rate. A spokesperson for Madison County says they are seeing cases come mostly from household transmissions among unvaccinated people, a similar situation in Oswego County.
This year more is, we call it a family micro cluster. From one person spread to another family member.
Cases from schools are also having a bigger impact now than they did last year. School-aged cases made up 4% of cases last year. It's at 11 this year. As Thanksgiving approaches, he encourages people to celebrate, but celebrate safely and assess the safety of your family.
The state health department is easing the restrictions on visiting a loved one in a nursing home.
Our Vanessa Rizzitano joins us live in studio with what you need to know about the changes. Vanessa.
Families with loved ones in nursing homes say further easing of restrictions has been a long time coming. After completely doing away with visitors temporarily or making adjustments, visitations are back with hardly any restrictions. People can now visit their loved ones in a nursing home, regardless of vaccination status or a COVID outbreak investigation. All they have to do is wear a mask. While places like the Dome require vax or test, Loretto Nursing Home, which assists vulnerable adults, does not. Julie Sheedy with the nursing facility is not concerned of a COVID spike, regardless of limited restrictions.
I feel confident in our protocols that are in place and that it's helped us keep our residents safe.
The Department of Health made the change to match federal guidance from the Centers for Medicare and Medicaid. She believes the recent announcement from the Department of Health could not have come at a better time.
And as we approach the holidays, this is critically important to the mental wellness and health of our residents as much as it is to our families.
Sheedy says the key to prevent another surge in cases is to visit loved ones safely.
Our visitors still have to follow infection control protocols, whether they're vaccinated or not, wearing masks. They screen when they come in at our kiosks. If they're having symptoms, please stay home. You know, we have a very vulnerable population here.
Testing is also available at the facility for those who would like one. In a meeting today, officials stressed their beliefs that the previous restrictions at nursing home facilities were just not fair.
One visit, one time a week through video chats or outdoor visits as an offering to care for a total care loved one in a long-term care facility is unacceptable.
These changes are set to take effect immediately, and although you may want to visit your loved ones for the holidays, officials stress to stay home if you are sick, as it is in the best interest for you and your vulnerable loved one. Reporting live in the studio, I'm Vanessa Rizzitano.